Welcome to part 2 of the Child Sexual Abuse Prevention Education webinar series. This section of the series will be focusing on the sexual abuse prevention education framework and teaching considerations. My name is Laura Beckman. I am the Director of Missouri Healthy Schools with the Office of College and Career Readiness within the Department of Elementary and Secondary Education. I am joined here by Jen Hale, middle school health education teacher in the Kirkwood School District. Both of us serve as representatives on the Missouri Task Force on the Prevention of Sexual Abuse of Children's Education Subcommittee, charged with the development of this guidance due to Missouri statute, which states that DESE, working in collaboration with the Task Force on the Prevention of Sexual Abuse of Children, develop a guidance document that schools can use to support implementation of the legislative requirements. The Missouri statute states that in school year 2020-2021, in each school year thereafter, each school district shall provide trauma-informed, developmentally appropriate sexual abuse training to students in all grades, not lower than 6th grade, and the school district training must include the following: instruction providing students with the knowledge and tools to recognize sexual abuse. Instruction providing students with the knowledge and tools to report an incident of sexual abuse. Actions that a student who is a victim of sexual abuse could take to obtain assistance and intervention, and available resources for students affected by sexual abuse. Here is a picture of what the guidance document actually looks like with a link to the website and PDF. You can be found online on our DESE's website. Part 2 learning objectives of the Child Sexual Abuse Prevention Education webinar series will address the following. It will review the new Missouri law requiring child sexual abuse prevention education in schools, the importance of health education, principles of prevention, teaching considerations, the framework, and the resources found in our appendixes.
Okay, let's start with the importance of health education. Health education is integral to the primary mission of schools and vital for providing students with the functional knowledge and essential skills to be successful learners and adopt, practice, maintain health-enhancing behaviors. Providing sound and validated information in a sequential manner is essential to teaching the goal setting and decision-making knowledge and behavioral skills on which a healthy lifestyles are built. In addition to its potential to promote health-enhancing behavior outcomes, estimates suggest that for every dollar spent on quality health education, we save more than $13. Schools are in a unique position to help people shape positive, healthy attitudes, beliefs, and behaviors that work to prevent sexual violence and other forms of abuse. Research shows that the most effective way to do this is by training adults, like all school staff and caregivers, and teaching students skills. This can be done by creating a comprehensive sexual abuse awareness and prevention program that incorporates evidence-informed best practices, inclusive policies and procedures, teacher and staff training, student education, and family education. To be effective in minimizing risk for a variety of conditions such as sexual abuse, it is critically important that a well-defined comprehensive health education curriculum be in place at all levels of education, providing the knowledge and behavioral skills that will be protective. School-based sexual abuse prevention education is supported by strong evidence and has demonstrated beneficial effects on academic outcomes such as attendance and school performance. In order to support students, your district will need to adopt sexual abuse prevention education curricula that is evidence-informed and reflects the needs of student population to ensure appropriate scope and sequence. Following the 9 principles of prevention will assist you in this process. The 9 principles of prevention are a set of criteria used to evaluate the potential usefulness and efficiency of child sexual abuse prevention programs. The criteria are taken from What Works in Prevention, Principles of Effective Prevention Programs, which is used as a review of reviews approach across 4 areas: substance abuse, risky sexual behavior, school failure, and juvenile delinquency and violence. to identify characteristics consistently associated with the effective prevention programs. Implementing these principles will provide a solid foundation for influencing positive outcomes in sexual abuse prevention and awareness. The guidance materials cover the details of each of these principles.
The guidance materials provide examples of several approaches to sexual abuse prevention education that are based on evidence-informed, effective prevention programs. When developing a sexual abuse prevention education program, best practices recommend the incorporation of following approaches: whole school, whole community, whole child approach, otherwise known as the WISC, the social ecological approach, the trauma-informed approach, and a culturally responsive approach. The whole school, whole community, whole child model is a systems approach to health and education. The model is centered, placing the child as the focal point. Represented in blue are the 10 school components surrounding the child that acts as a hub that provides the full range of learning and health support systems to each child in each school and in each community. One of which includes the delivery of formal, structured, comprehensive K-12 health education that is aligned to the National Health Education Standards, incorporates the characteristics of an effective health education curriculum, and is provided by qualified trained teachers that is so valuably important to the learning, development, and health of students. The community represented in yellow demonstrates that the school is the focal reflection of its community and requires community input, resources, and collaboration in order to support its students. The white band emphasizes the alignment, integration, and collaboration needed among the school, health, and community sectors to improve each child's learning and health. Health education, based on an assessment of student health needs and planned in collaboration with the community, ensures reinforcement of health messages that are relevant for students and meet the community needs. When a systems approach using this model is in place, it ensures that students are healthy, safe, supported, and then can be engaged and challenged in their learning. Thus, Maslow's hierarchy of needs. By coordinating policy, process, and practice inclusive of all these components that support the whole child, we are able to coordinate and collaborate among these areas to facilitate awareness of issues, leverage resources, and reduce program duplication, as well as fill gaps. The Healthy Hungers Free Kids Act is a good way to start from a district wellness council that is effective and can provide decisions that are informed. All the approaches listed are covered in greater detail in the guidance document and integrated into the guidance.
The framework provided in the guidance also reflects the National Health Education Standards, which you can click on there, the CDC Health Education Curriculum Analysis Tool, the Missouri Health Education Grade Level Expectations, the Missouri Comprehensive School Counseling Program, Social Emotional Development Grade Level Expectations, and the National Sexuality Education Standards. These are organized following the 8 National Health Education Standards. The guidance document uses these standards, but each standard is applied specifically to sexual abuse prevention education. You can see this in the chart of standards in the guidance document. Sexual abuse prevention strategies are more likely to be learned when received through comprehensive skill education that provides opportunities to practice skills in class, instruction that spans multiple days, and the engagement of parents or guardians through take-home activities to foster discussions. Research advises that education that exercises concepts of universal design for learning through the use of more active modes of teaching, modeling, rehearsing, reinforcement, results in greater gains of knowledge and skills than those that simply provide information, particularly when working with students with disability, either intellectual or developmental. Universal school-based education directs age-appropriate grade-level activities towards all students and does not target those whom circumstances place them at the increased risk for perpetuating or being victims. The guidance includes teaching considerations and practical tips for delivering this content. I would like to highlight a few here. To provide effective sexual abuse prevention education, educators should provide instruction delivery that accounts for classroom structure with norms that promote and model respect, safety, nonviolent inclusion, and trust between teachers and students and their peers. Appropriately planned and timed instruction that ensures support staff availability and notifies family and students in advance. Age-appropriate instruction that provides student leadership and ownership opportunities, peer learning and mentorship and awareness events. Confidentiality and comfort for a system where students can anonymously submit questions. Also, partner with local agencies and organizations that can provide support and assist with delivery of education. Develop relationships with family and community members along with distribution of resources to reduce discomfort about sexual abuse prevention education. We will look more closely at the standards outlined in the guidance document that support sexual abuse prevention within a comprehensive health education program in the next few slides. School sexual abuse prevention approaches will differ depending on the grade level of students. Comprehensive sexual health education is an effective sexual abuse prevention strategy. Information and skills provided in grades K through 5 lays the groundwork for healthy relationship education in later grades, which demonstrates the importance of implementation of a K-12 comprehensive health education. Universal school-based education directs age-appropriate grade-level activities towards all students and does not target those whose circumstances place them at an increased risk for perpetuating or being victims. Adopt sexual abuse prevention education curricula that is evidence-informed and reflects the needs of student population to ensure appropriate scope and sequence using the universal design for learning, trauma-informed, and equity approaches described in the guidance. In the next few slides, we will focus on the standards for grades 6 through 12 as legislation mandates education for 6 through 12, but the guidance gives examples for elementary based on evidence-informed prevention of efforts and best practices that currently exist for sexual abuse prevention. This section provides a curriculum framework of age-appropriate standards and performance indicators for students in grades K to 12. The framework is organized into the following grade clusters: grades K2, grades 3-5, grades 6-8, and grades 9-12. Within each grade cluster, there is a chart listing the health education standard and performance indicators defining what about sexual abuse education students should know and be able to do by a specific grade level. On this slide, you'll see an example of the suggested standards for interpersonal communication and decision-making for middle school students. On this slide, you'll see an example of suggested standards for self-management and advocacy for high school students. Lesson plans and programs that can ensure your students meet these standards are included in Appendix B of the guidance document. By reviewing current course materials, you may find that some or even all of these standards are integrated in your existing health class. If not, the guidance document contains references for programs and materials to fill in the gaps. There are many ways to approve and implement a sexual abuse prevention education program. To do this, there are specific areas of the guidance document you may want to reference and models to promote successful sexual abuse prevention education. This includes selecting lessons and delivering with existing staff and or partnering with local agencies and organizations that focus on sexual abuse prevention to deliver an evidence-informed sexual abuse prevention program. In Appendix A and B, there is a list of national, state, and local agencies that support sexual abuse prevention for both students and families. Appendix B was created to ensure that existing resources are utilized in meeting the legislative requirement that each school district should provide a trauma-informed, developmentally appropriate sexual abuse training to students in all grades, not lower than 6th grade. The resources were compiled by the Missouri Task Force on Prevention of Sexual Abuse of Children's Education Subcommittee, convened by DESE and Missouri Kids First. The list does not constitute endorsement by DESE, nor is it exhaustive, but it is a good place to start. It is up to each school and child-serving organization to assess specific resources and needs and then decide on a program that best suits its students and community. Per Missouri law, school districts must notify parents or guardians in advance of child sexual abuse prevention education and of the parents or guardians' right to have the student excused from the instruction. A sample parent opt-out letter is included in Appendix D. In addition, it is recommended that parents and guardians be provided with an overview of the context of the curriculum. This builds community and family buy-in and can allow for additional parent-caregiver education and discussion on the topic.
I want to leave you with some next steps to move forward with providing sexual abuse prevention education for your students. No one administrator, educator, or parent can or should shoulder this responsibility alone. Appendix C, Guidance for Implementation of Sexual Abuse Prevention Education, summarizes the role of local education agencies, schools, and classroom educators in this process. The guidance document should give you a foundation to work from, but you will want to engage other stakeholders, follow your district's process for selecting and approving educational materials, and ensure high-quality implementation with professional development and evaluation. A comprehensive approach to health and wellness looks beyond what is happening in an individual classroom and encourages the support of the whole school, families, and extended community. It provides the emphasis, coordination, and support from both in and out of school environments to assist students with their health and wellness needs and in developing health and wellness literacy. Such a framework is designed to not only engage students with the issues and decisions that they presently might face, but also to support them ensuring that they can maintain and improve their health and wellness throughout their lives. I hope this webinar on the Sexual Abuse Prevention Education Framework and teaching considerations assists you in your work. There are additional webinars available to address the trauma-informed approach and engaging community partners. You can learn more about these and download the guidance document by visiting DESE's website.